Let me introduce you to Kate Allett. Kate was a healthy mum who loved running until she developed a brainstem stroke, aged 39, that left her with locked-in syndrome. She couldn't breathe without a ventilator, and her only voluntary movement was blinking. It took weeks before someone, her best friend, worked out that she was actually fully aware, even though she couldn't move. The medical expectation was that Kate would need full nursing care for the rest of her life. Kate's expectation was that she would be back to normal with her family within a year. 8 months later, she walked out of hospital. 4 months after that, she went running. As a medical doctor, this really got my attention. There is no cure for locked-in syndrome, and most people don't survive the initial brain injury. Those who do only rarely regain some limited movements. So how did Kate do this? Well, the first thing she did was to decide that she was going to recover. Her mum kept reinforcing the idea that the brain can create new neural pathways, so to Kate, it was possible. In her mind, she set a long-term goal, and then she broke it down into bite-sized chunks. The first of those was actively willing her thumb to move again. She repeated this mental visualization endlessly until 5 weeks later, this was her first movement. She then turned her attention to moving her hands, her arms, sitting up, breathing on her own, swallowing. There were setbacks, but she stuck to her intention and she overcame them. This was not a random recovery. At each stage, her body responded to her point of focus. Her point of focus was everything, and this was within her control. I got into medicine because of a fascination for how astounding the body is. We don't have to worry about what our liver cells are up to with last night's wine, or remind our cardiac cells to contract 70 times a minute. They're already on it. If you think about the number of functions our cells perform over the course of a day, it's mind-blowing. Yet we seem to have lost sight of this. How many of us focus on our body's ability to repair itself when we're sick? Most of us don't even notice our bodies until something goes wrong, and then we give that problem our full attention. We worry about it, which just compounds the stress response. Then we go to the doctor to have the problem fixed. What if there's a better way to deal with things? Doctors can't fix people unless they want to get better. And it's not so much that they fix people anyway, it's more that they facilitate the body's own ability to repair and recover. But as a society, we've been conditioned to hand over all control when we're sick. Our modern view of medicine is not so modern. It dates back to the 17th century when René Descartes began dissecting things into smaller pieces to try to figure out how they worked. He saw the body as a machine, and we're still very much working within the framework of mechanistic medicine. Reductionism is brilliant. It's helped us understand things like molecular biology and biochemistry. It's been so effective that the general view in Western medicine now is that mechanistic medicine is the only kind that really works. It does work, there's no question about that, but it's not the whole story. You can't dismantle a computer and study the wires and expect to understand computer programming. And you can't dissect out a neuron and expect to understand what it's thinking. Einstein said, we can't solve a problem with the same thinking we used to create it. We understand sickness now, but if we want to engender health, we need to focus on health. We need to look at the outliers on the bell curve, those people who survive and recover and thrive against the odds, and ask, what are they doing? Research is now showing us that thoughts influence physiology. This is so obvious that we've overlooked it. Think of a sad memory, and your body produces tears. Think of someone you're in love with, and your heart rate goes up. And think of the placebo effect. If we're working from a mechanistic standpoint, giving someone a placebo should not affect them, but it does. Taking a placebo alters brain activity that we can see on functional MRI scanning. Our brains actually produce the neuropeptides that mimic the drugs we think we're taking. So what we think we're taking matters. This is also true of active drugs. For instance, a study by one of the world's leading placebo researchers shows that diazepam does not reduce anxiety in post-operative patients unless they know they're taking it. So expectation is key. So we're seeing this in research, and we're seeing it in real people. I've mentioned Kate. Now meet Kathy from Glasgow, who had advanced lymphoma and used repetitive visualization to help shrink her tumours. 9 months later, they were gone, without chemotherapy. Or Colin from Liverpool, who had an inoperable brain tumour and was given just a few weeks left to live. When he saw his brain scans, he began imagining his tumour shrinking. That was 15 years ago, and he's been clear since. And there's lots of cases like this. Is this all just coincidence? I don't think so. This is not wishful thinking. This is repetitive, practiced thought. And it's not a quick fix. It's hard work. These people are coming from a place of utter disempowerment and yet finding it in themselves to stay focused on their intention. As Kathy said, you have to want to live and engage with life. Symptoms are a signal from our cells that something needs to change. Thoughts are our way of talking to our cells, and our cells are listening. Neuroscience research shows us that brain plasticity is now a fact. Epigenetic research shows that emotion, how we feel, alters gene expression, protein production, and cell function. Hopelessness has been identified as a strong independent predictor of heart disease. Studies show that optimists live longer and have better immunity. And we have control over this. You can become an optimist by practicing seeing the best in things. Viktor Frankl was a Holocaust survivor, and amidst the relentless horror he endured, he found something every day, some act of kindness or compassion, and he gave that his full attention. As he said, everything can be taken from a man, but one thing, the last of human freedoms, to choose one's attitude in any given set of circumstances, to choose one's own way. It should be easy for us to find things that make us feel better, but it's just a case of investing time in them. Listening to music we enjoy increases dopamine levels and improves mood. Watching a comedy, laughter improves immune function. So how we think and how we feel and what we believe matters. What the doctor thinks matters too. There's now strong evidence that the expectation the doctor sets impacts on patients' response, and good practitioners know this. But what about giving false hope? Well, we're not talking about making guarantees, just highlighting possibilities. And we're not talking about abandoning conventional medicine, but enhancing it. If full recovery from locked-in syndrome or end-stage cancer were not possible, it would never happen. But it does, so it is. Isn't it our job as doctors to inspire people to better health? And what if guarded expectations of recovery are actually setting limits on patients? What about the media? The media sets expectations for the public. By focusing on NHS failures, it's missing all of the good things that happen in healthcare every single day. Medicine is still evolving, and we have the opportunity to learn from patients who prove us wrong and who stand as an example of what's possible. Our observations are telling us that focus, belief, and expectation are entangled with health. Rather than dismissing them, we should be curious. Just as the physicists had to concede that classical physics doesn't cut it anymore when they began to observe quantum effects, we need to rethink the paradigm we're working within. We've come a long way, and we have a lot to celebrate. We have a coordinated system of healthcare, free at point of access for everyone in the country, and you only have to travel to see how lucky we are. The NHS is the world's best healthcare system, and yet patients are dissatisfied and staff are demoralised. Some of the highest rates of sickness and absence are amongst healthcare professionals, the very people who are meant to be advocating health. We have to rethink something. As doctors, we can empower people to develop more control over their own well-being through attention to how they're thinking and feeling. Descartes himself said, "I think, therefore I am." We are not machines. We are mind-body beings with more influence over our outcomes than we've allowed ourselves to believe. So why not here and now? Scotland is standing on the shoulders of giants in medical innovation, those scientists who discovered insulin and penicillin, who pioneered ultrasound and MRI scanning, to name just a few. We already have the NHS. We have people who can inspire others through their own remarkable recoveries. We've influential medical staff who are open to this way of thinking. And we have journalists who can make a powerful contribution to the nation's health through their choice of reporting. But the greatest role here lies with you. Take back some control. True empowerment is choosing how you think and feel. There's no reason why not here and why not now. Thank you.